Tonight in our 7 Up Front report, the vaccination rollout in communities in Wayne County. Joining me now is Dr. Muhannad Hamami, the Chief Health Strategist for Wayne County. Dr. Hamami, thank you so much for being here.
Absolutely. Good to be here.
Good to have you. Let's start with the vaccination effort to date in Wayne County communities. This is a huge logistical challenge, of course, with more demand than supply right now. You've had numerous clinics this week around the county. What's your general assessment so far?
So far, we've been operating against all the odds. We have been accomplishing a lot. I think our biggest accomplishment so far is that we have done most of the educators in Wayne County. All those that wanted the vaccine received it, and that is good news for those, especially with the school opening. We shifted our attention to support our health systems in addressing our senior population, 65 and older. And this is our first week in addressing those. We wanted to approach it a little bit in a different way, where we are taking the vaccine to the communities and specifically to where senior centers are. So our partnership with cities and municipalities and community centers was very valuable. It wasn't smooth. There were some challenges, and mostly it was in maintaining the scheduling and the capacity to schedule our seniors. But so far, as we started on Tuesday and today with tomorrow as our final day for this week, everything is going very smoothly.
We've reported on some of those issues that became apparent this week, including people calling for appointments and not being able to get through. I think that was in Canton. What changes, if anything, after experiencing this week, do you anticipate moving forward?
So the problem was that when we publicized the phone numbers, and mind you, these are the city's own operations phone numbers, and they did not expect the load that is going to happen. I think Canton in less than 2 hours had almost 1 million caller, and those were from people that are outside of the community. So we re-emphasized that we are approaching this as each community has its own churn, and these are very much limited to the days that these communities are assigned to. And we also advised against to have a better system in how we handle those. We have a lot of information that has been disseminated, and so far everything is going well. Our partners at these communities have been doing a great job and has done an amazing job in streaming through those challenges.
The city of Livonia, for instance, said their approach worked well with online appointments and the use of city personnel to get shots into arms. Is that a model that can be duplicated by other cities, municipalities?
Yes, absolutely. So as you might know, the CDC and the Michigan Department of Health and Human Services approved certain entities to be COVID-19 providers. Unfortunately, this process is taking longer for communities to be approved. Currently, the only a few communities that are approved, including the City of Livonia Fire Department and the Dearborn Fire Department, as well as Dearborn Heights. These are the very valuable partners where we can give them the vaccine and let them run their own operation. For other communities that do not have that license, unfortunately, we still have to be present and help them with that. However, most of the EMTs, most of the emergency medical services and the volunteers have been recruited from these communities, and they have been truly an added bonus to our operation.
Let's talk about the availability of vaccine right now to fill that great demand that's out there. What are you hearing from the state, for instance, in terms of what's coming next week, what's coming in the weeks ahead for Wayne County so that you can try to fill that great demand?
So we certainly are seeing a little bit more of what we used to get, especially last week. We got, for example, 15,000 first doses, which enabled us to do this in our communities. Unfortunately, we heard this today that we're getting less this week. So we're getting only about 10,000 first doses. That, again, I said it so many times, the inconsistency and not knowing what we are getting, that inability to predict is going to put a burden on how we maintain the schedule and how we move forward. Also, sometimes we're getting more Moderna, sometimes we're getting more Pfizer. to us, it doesn't matter, but we also want to ensure that as we are holding clinics, we know which clinic to hold. So these are the only things that we still would like to have more consistent from the state. But overall, the shipments that we have been getting are getting more and more, with a little bit of like what happened this week where we are getting less. But we hope that this will continue, especially with the news of more production and the possibility of having a third vaccine as well.
That would be helpful indeed. Dr. Hamami, we thank you for your time tonight and the update, and hope that the weeks ahead go well for Wayne County communities in terms of getting shots in arms.
Thank you.
Thank you.